So I want to thank everybody today for allowing me to give this presentation. Harry's informed me that I have about 15 to 20 minutes, and so hopefully I'm going to get through this pretty quick. So with that, I'm just going to give kind of a very brief overview of some of the things we're working on and talk about our swine health business plans a little bit, which are trying to explain and help guide us to move forward on our initiatives to the future to assist producers and stakeholders there. So we're going to give an update of some of our CIS activities, business plans, and talk about just a little bit about SECD and some of the collaborations we're working on there. Comprehensive integrated surveillance is a huge topic right now. It involves pseudorabies, swine brucellosis, classical swine fever, ASF, FMD, all these together when we're looking at even though at one time, like pseudorabies and swine brucellosis, we've moved away from the stovepiping of certain diseases and are now under one umbrella. These diseases together incorporate the comprehensive integrated surveillance activities, and we have implemented many of these activities. We are looking at passive surveillance in slaughter plants and analyzing that data and providing that data back to stakeholders. We are working with the industry on multiple diseases such as animal traceabilities, the PIN tags. We are working on trying to utilize FMD surveillance in many of our laboratories using those high-risk samples such as garbage feeding swine, samples that meet the case criteria for the disease of concern. And so that together under the umbrella, we are implementing an integrated CIS activities. I'm also going to talk a little bit about SECD and other activities that we're working on pertaining to trichina, where we're collaborating with industry to move forward on trying to identify a solution with industry to develop a possible. We're weighing options right now on trichina on how to move forward with that program. So with CIS, we have the pseudorabies, swine brucellosis. These surveillance streams we implemented back in 2009. Looking at our diagnostic laboratories, our high-risk streams for ferals, if high-risk streams, so if you have exposure to feral swine, those swine will qualify as high risk. Feral swine are a risk for pseudorabies, swine brucellosis. Approximately 21% in FY15 that were tested as opportunistic samples by Wildlife Services came back as PRV positive. They are a risk, they remain a risk. We need to educate our producers about those risks so they can take precautions to prevent the disease from moving from the feral swine interface into our commercial industries. From our slaughter swine surveillance activities, slaughter surveillance last year, all those samples came back as negative. Slaughter surveillance activities, we've generated negative samples of slaughter surveillance for many years now for both swine brucellosis and PRV. The samples we do find that are positive, that lead to positive herds, are coming from our high-risk streams, our herd states that are actually implementing high-risk testing plans, such as Hawaii, Arkansas, Georgia, states where there's feral swine, where they actually do the high-risk testing off their high-risk herds. Those are the herds we're actually finding disease in that transitional herds where they have that exposure to feral swine. But the slaughter surveillance going on in the big commercial kills has been negative and has remained negative for many, many years. Classical swine fever, we have the goal of rapid disease detection for classical swine fever, and we're targeting 5 areas: waste feeders, backyards, feeding herds, sick pig specimens, high-risk slaughter swine, feral swine. Wildlife Services is collecting samples off the feral swine that they capture, and FAD investigations. And with that, our numbers, you'll notice that there is a slight increase in numbers from FY13 to FY14, but there's an opportunity to stay vigilant and to do better, to get more samples in, to get more high-risk swine in. Because FAD submissions, in light of PED in 2013, we had 3 swine FAD investigations. In 2014, we've had 4. There's that opportunity out there to these samples that come in that may, CSF can look like any disease. It can look like circovirus. It can look like other viruses. Yet we still remain fairly low on our FAD submissions. So that's why Going to collaborate with Harry a little bit to try to get messages out there, because many of these sick pigs that are sent to the diagnostic labs, even though we've seen an increase, there's that opportunity to test more samples there. And we also have the opportunity to take other additional samples for foot and mouth disease and ASF to piggyback on that stream too for those high-risk swine, assuming they meet the case criteria. Influenza surveillance activities. It's kind of a chart giving a brief overview. This number goes through mid-February. We're right on track for FY13, FY14 for influenza A surveillance in swine. And you see those increases there. And when we look at that, you can see this chart here kind of gives a brief overview of our accessions that have come in. And over there on the left-hand side, you know, H1N1 is our predominant, and H2N3 are our two predominant viruses that we're finding in FY14 and FY15, with H1N2 being amidst the third there, and a little bit of H3N1 and mixed viruses and 83 herds last year. And this chart is presented by the month and kind of goes up and down. You can see some seasonality with it. Depends on what time of year that we're looking. And with that, with our influenza A in swine program, in 2014, NVSL did implement some changes to the testing algorithm, which allowed us to have an increase in percent positive samples from virus isolation from about 31% to 46%. And with that, so we now have more samples going into the repository. And with changes that we implemented in the repository, when those samples come in to NVSL, we're only growing those viruses chosen to go into the full genomic sequencing, and that's a random, about 16 per month. And viruses identified as interest by NADC, so we're collaborating with ARS, Animal Research Service, to determine those viruses of interest. And there may be some results of delayed results due to that, when those viruses are not already grown out. Other activities that were going on with influenza A in swine pertain to the program analysis and review. Just recently, National Pork Board Producers Council sent a letter to Dr. Clifford asking us to do a review of the program in light of funding initiatives and the need of the funding to support this program. So we have implemented actually 2 reviews right now that are ongoing. One of them is an internal analysis through our APHIS PPD program policy department. And they are actually analyzing it from an internal review. So they're analyzing the program, the achievement, the outcomes. They're talking to stakeholders. They've talked to some producers out there. They've reached out to academia folks such as Iowa State. I know they've reached out to industries such as Dr. Snelson's group with ASV, National Pork Board, and other universities out there to try to get an understanding of what are your stakeholders' viewpoints? How is this program helping you? How is this information used to help you? How is this beneficial to taxpayers out there? And how do you use this information? So PPD has been reaching out to many folks right now to get an internal review. And with that, we're also doing a external review from an epidemiological standpoint, where we're looking at the samples collected. Are there ways we can improve the efficiency of this program? Right now, most of the samples that come in are anonymous submissions through the diagnostic labs. Are there ways we can improve the design of this program to get better data, to assist the stakeholders more? And so that review has been contracted out and is ongoing right now. It's just started here recently, so we should have results with that here in the near future. Other CIS activities pertain to the pilot that we started in August FY14 of this year. And so we're doing an ASF FMD surveillance pilot, and it's to enhance the awareness of collecting samples. And this is great collaborations, been a great collaboration experience with our field staff to try to get samples coming in from them high-risk areas and case qualifying samples. There's a lot of legwork that has been needing to take place to get this program up and going. A lot of communications that need to take place to get this program up and going and get these samples to come in. And it's been a good experience for vet services so far. we are implementing and testing for ASF and FMD right now in 8 known laboratories. It's to collect the baseline information for surveillance that we can use to substantiate our ASF FM disease freedom, and hopefully this helps in detection of early disease detection. We are using with FMD, ASF. You have to use extreme caution to make sure everyone understands our communication plan. It would be detrimental to everyone if false positive information was released unintentionally or inadvertently. That could have potential impacts to many stakeholders. So we are exercising the communication plan, and success of this program the communication plan is very similar to the CSF plan to ensure that all parties that are sending in the samples, testing the samples, reporting the samples, understand the communication process and can implement it in an effective and timely manner. Communication with this is very important. And it also helps increase our diagnostic preparedness at the laboratories. So if we did have a foreign animal disease outbreak, how do we get the capacity to test more samples? They need to be testing all along to have that familiarity of testing samples to help us during that outbreak. So it's a 12-month pilot. We're using the same notification plan as the CSF. If during this time, if any of our field staff are out on the farm and notice clinical signs compatible with FMD ASF, that it turns into an FAD investigation and is not running through the surveillance pilot, it turns into an FAD investigation at the time. We're using real-time PCR, and we're testing whole blood for ASF because that is what's validated by FADL. And we're using oral swabs. And this is moving through August of 2015 with plans underway on how to continue that throughout the future now. EPS, slaughter condemn data. This is data coming from USDA Food Safety Inspection Service that's collected at all of our slaughter plants. It's monitored by our folks in Fort Collins every week, where they run it on a statistical analysis program to look at our sow boar, roaster, market swine. This program showed its importance back with erysipelas many years ago, that showed a track and trend upwards in cases where we can help see what's going on at the market slaughter plants and then relay that information back to producers and practitioners out in the field. We're looking at antemortem condemns, seeing central nervous signs, dead on arrivals, pyrexias, septicemias on postmortem condemns, erysipelas, and pneumonias. And as that information gets recorded into FSIS databases, it sends signals to us as APHIS when we analyze the data. There's a baseline, and when that signal goes above that baseline, we send that communication to industry to let them know that there's an activity going on in the field. And recently, we've been communicating with industry on TB findings, that we've had a spike in tuberculosis recordings at many of our FSIS inspected slaughter plants. Try to keep things moving here. SECD, we implemented the federal order on June 5th, 2014. It established mandatory disease reporting. It is a disease reporting program. It also established requirements for development of a herd plan and monitoring management plans for when that disease is on a confirmed herd. And there's a confirmed herd associated with it, I need to say. This chart kind of gives a brief overview of the reported findings put out by USDA as of a couple weeks ago. And to keep things moving, this chart also from a couple weeks ago was the latest map of where PEDV has been found in biological accessions. You'll notice that states on there like Georgia, who have had confirmed findings right now, and this is as of March 11th, are not highlighted in there. And there is a lag time from when the disease is found at the lab to where you have a confirmed case on the farms. And there is a lag in there, and when it gets entered into our EMRS system, and that's why some of those states might not be showing up yet, as it has to be investigated and reported back from our disease reporting officers who've collaborated with the practitioner that sent in her sample, and we actually have confirmed disease on that farm. So the reports are issued weekly, and reporting continues as of right now. We are working with industry on discussions for the next steps for SECD. The next steps meaning, how do we look at this program in the future? How do we continue it in the future? Do we move towards writing an interim rule? Do we move towards keeping the federal order in place? Do we move towards eliminating the federal order? Where do you see the next steps for this program? And what are your thoughts and feelings on that? So those discussions are occurring right now to try to understand where this program should go in the future. Should it evolve into an emerging disease program? There's many, we are having numerous discussions right now with industry on how to take this forward. And if you guys have opinions, thoughts on your feelings of the SECD program, please express them to USDA. But with the program so far, we have had some successes. And that includes premise ID usage at the non-labs. We've seen a dramatic increase in our prem IDs. Development of an accounting protocols for payment to producers. If we did have an FMD outbreak or other outbreaks, we've established those accounting protocols to assist industry in a rapid fashion. And we've had a lot of industry state engagement. Our DROs, Disease Reporting Officers, is what DRO stands for, have been working with practitioners. We've rebuilt that bridge again with all of our swine practitioners to understand what's going on with producers. So that to get that background information, we've had a lot of state industry engagement from the DRO side, working with producers, to working with our state animal health officials, to obtaining that information we need for this program. So that part of this has been very successful. To finish out my presentation here, I'm going to go over the next few slides, our swine health business plans. And Dr. Myers has asked us to put together swine health business plans to outline our priorities, objectives, and strategies for the next 5 years. It's a rolling 5-year plan. These plans are tools to help guide spending plans for congressional appropriations. They encompass not only all of our swine health activities, but they also encompass One Health, our surveillance and emerging disease issues. And your opinions as a public comment is encouraged on an annual basis to help guide us to make sure that we're addressing, the USDA is addressing the swine health issues of concern to you. And you can help move things up and down on the priority list for USDA. So for FY15, and the business plans are all online, publicly available for public comment. And for FY15, some of the activities we plan to continue is doing a cost-benefit analysis of our cyst swine surveillance activities. What is the benefit of doing all of our different surveillance programs to industry, to stakeholders, and put that in a cost-benefit analysis. Develop an overall cyst strategy. We're going to complete our ASF pilot, which ends in August, and doing an evaluation of that. Try to identify some of the non-regulatory and regulatory mechanisms for swine disease programs. Continue the pathway assessment that Dr. Scott started on how do viruses possibly get into the swine herds. Develop plans for implementing swine brucellosis in select non-labs. I think we were going to try to pilot that this year in certain labs. And we're going to continue collaboration on enhanced passive surveillance activities. Emergency response and planning, we're going to look at database improvements and connectivity issues, and we'll be collaborating with industry on that. Collaboration on the secure pork supply plans, and collaboration to harmonize emergency response plans and data sharings with industry, because there are various plans out there, and especially on some of our emerging disease plans. We have our NIAA proposed plans, and I know the swine industry has also put together emerging disease concepts, and we're going to collaborate together to make sure that they work for all stakeholders. Field disease surveillance, investigation, and control activities. This is a very important part of our swine health plans, and that's continued enhancement of epidemiological activities. Our field epidemiologists, our ADDs, were instrumental when SECD was first identified, from doing some of the background investigations, going to the farms, helping gather that information needed for industry and stakeholders. We're going to continue those activities and continue their collaborations. Develop EMRS for Swine, which is a database for recording our FAD types of investigations so we can have a better understanding of what's going on in the field. And general collaborations with state tribal industry on feral swine issues and identify those risks, international risks of swine health concerns. We're also going to continue zoonotic disease prevention plans. We're going to explore alternatives for the trichina program, and we're working with National Pork Board right now on those alternatives. We're going to collaborate with ARS on influenza A and swine activities, and work with public health stakeholders to evaluate food safety information as necessary. Special projects for the swine health business plan include working with industry on the premise identification tags, complete ASF, CSF International sample collections, where right now we have we're working with stakeholders, and we provided grants for those to apply to, where they can go collect samples for us to send back to SFATL for hopefully to allow us to obtain a validated disease test in the future, where we need samples to test. Collaborate with NVSL to increase our diagnostics and support collaborations on the feral swine management program. So we have a busy year, as you can see, which includes enhanced communication and outreach to many stakeholders. And I know I'm running long on time, Harry. With that enhanced communication, it involves getting the message out, and it involves outreach to our state partners and industry. It involves updating a lot of our resource material and continuing to update that to give you the best material that you can provide to your stakeholders on the activities USDA is doing, and develop general communication necessary for revising state status validations. There is a need there on our state statuses that a lot of that needs updated, and we need to get that communication out. So the swine business plans, to kind of speed things up here, they're not set in stone. They are revised year to year on a rolling 5-year basis, and those priorities can change depending upon your public comment. They are online. They are online, located at the website. With the changing of our website names, that's really long to remember, but if you just search for veterinary services business plans on the USDA homepage, you'll find them. We encourage public comment to help guide us, to help direct us on what should be the priorities and what might we be missing, where we need to focus our activities, so that your public comment is encouraged.